how are you today? Good. My name is Lee, and I'm going to be the one taking you back today and just gathering the history. So what's bringing you into the clinic? Just kind of a wellness check. You feel like you may be getting sick. Okay. And what sort of symptoms do you have going on today? Okay. Any fever, chills? Any coughing at all? Okay. What about shortness of breath? Chest pain? Okay. Anybody around you that's sick, as far as people that you live with or maybe in the workplace? Okay. And are you up to date on your vaccines? Okay. When do you think that one was? Okay. Have you tried anything over the counter at all to help your symptoms? Okay. All right. Any heart palpitations? No. Skin changes? Okay. What about abdominal pains? And any change to constipation, diarrhea, blood and stool? Any heartburn at all? Okay. As far as nose, any nosebleeds or runny nose? Okay. Any numbness and tingling? Alrighty. If we have to send you any medications, is there a preferred pharmacy that you have? That's the one on 4th. Okay. Alright, I will be sure to send stuff there for you. Awesome. So if you wouldn't mind, I am just going to get your vital signs, just collect the general information, then the provider will be in, just do a quick assessment and just kind of probably roll out strep as well as COVID. So we'll probably want to do some swabs and just kind of a generalized exam, okay? Absolutely, yes. I just wanted to make sure you're okay with that. So I am just going to put some sanitizer on. So let's just start with some vital signs. So we are going to collect a blood pressure first. I am just going to fit this around your arm here. And if you wouldn't mind making your feet flat on the ground, that would be appreciated. Thank you. And I'm just going to put this in here. Let's get this vitals going. Let me take this off for you. Okay. Your blood pressure was a little bit high today. Does it normally run a bit higher in doctor's clinics? A little bit? Okay. Yeah, no, I don't blame you. This is no one's favorite place to be. Okay. Let me just get this set up here. So let me put that into the system here real quick. And then of course I am just going to have to check for a fever. Perfect. All right. Let me just click that there. All right. Let's get your temperature. the season where people are starting to get COVID, flu, just a bunch of these viruses going around. Yeah, no, my sister, she works with 1-year-olds right now, and she's had something for the past few weeks. There's just a lot going on. All right, this is gonna go right underneath your tongue. 1 second while we collect that result. Alrighty. Temperature is okay. You're not in the fever range yet. Alright. Do you think you'll be able to leave me a urine sample? Okay. Let me just put some patient information on here. And so the provider will be in to do your general wellness exam just to make sure all is good. I'm gonna leave this cup for you here if you wouldn't mind leaving a urine sample before she comes in for the exam. Everything is set up for her. We'll just want to leave her the stethoscope, and we'll probably need to grab her some gloves. All right, and so I'm gonna just put these on the counter here for her. There is a drape, if you wouldn't mind just getting undressed and wrapping yourself with this drape, and she'll do the full physical for you, okay? Yes, and then we'll do all the testing. We'll get everything figured out for you. We do have a few prescription medications here, so she may send you home with some, but I will give you some privacy, okay? I'm gonna make sure that we get you checked in and that you are all good to go there, so she knows that you're here, and she will be in shortly to take care of you. You are very welcome. All right, she'll be in shortly. Hello, it is very nice to see you. My name is Leanna, and I'm the provider that's going to be doing your wellness assessment. Lee, the medical assistant, was just telling me everything that you've had going on. So if it's okay with you, we'll just get started with the examination, okay? Awesome. Awesome. All right. I'm just going to put on some gloves here. So get this going. All right, and I am just going to grab a light. Alrighty. So the first thing that I am going to start off with is I'm just going to examine your scalp, okay? So you're just going to feel pressure from top here. You let me know if anything causes you pain. Just making sure I don't see any lesions or masses, no swelling. No pain there, right? And I don't see any lesions or anything wrong with the scalp. Perfect. Let me get you covered up here properly. Alright. Okay. I'm just going to press on your forehead. I'm going to kind of note the lymph nodes as well. Press on your maxillary and frontal sinuses. Make sure you're not having pain. Okay, maybe a little bit of inflammation. Okay, right under here. Press on some. Okay. Very good. I am just going to shine this more specific light in both your eyes. You can look straight across for me. I'm just going to move your eyelid here a little bit. Okay, very good. Just going to move your eyelid up a little bit here. your pupils. Give me a second. Look straight ahead. Okay, at about 5. We're gonna do this eye here. Okay. If you wouldn't mind, if you could lift your head up, just gonna look at the nostrils. Same thing here. Good. Alright. One thing I am going to want to do is just measure sensation here. So I need you to let me know when you feel like you can feel a little poke on your face, okay? Good. Close your eyes. Sorry, I forgot to mention that. Good. 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 Very good. Excellent. Good. Very good. Now, this is going to feel like a soft swab. I need you to tell me if you feel it equally on both sides. There. Equal. Okay, what about this? Right here. Equal. Very good. I want you to tell me if you could hear the sound equally on both ears while I cover one side. Good. Good. Good, good. Next up, I have a tuning fork. I want you to close your eyes and let me know when you can hear ringing. Very good. Excellent. Good. Very good. Hearing appears to be intact. Just going to take a quick look in your ears. It doesn't look like there's any external ear infections at all. So that's really good. Let me go over here. Okay. Everything looks healthy that side as well. Going to press on both ears. Any pain? Good. Next up is we do have to do some swab samples, so I apologize. Okay, sorry about that. And so I'm going to shine this light. If you wouldn't mind saying ah. Just going to do a couple swabs here just to get you screened. Let's go really quickly. Okay. So the test is done. We're going to do the strep test. Good. Doing great. Done. You did awesome. I am going to send those out to the lab. So, next up is I need to listen to your heart and lungs. So I am just going to grab my stethoscope here. I'm going to move this light out of the way for now. Just going to listen to your heart. Just going to move this a little bit over. Very good. You could just breathe normal. You're doing great. Okay, heart sounds are good. Can you take a deep breath in and out? Deep breath in and out. Deep breath in and out. Deep breath in and out. Okay. Next step is I'm just going to press on the chest area here to note for any inflammation. Going to take a quick look at the skin around your chest. Make sure I don't see any suspicious moles. I'm going to do some percussions. Chest wall, everything there looks good. good. Okay. Alrighty. Now we're going to move a little bit lower to the abdominal region. So I'm just going to move it down a little bit over. You let me know if you get too uncomfortable. Just going to take a quick look at your abdomen here. A general inspection. Again, making sure I don't see any suspicious moles or lesions or any evidence of hernias. Very good. I'm just going to press on the quadrants. You let me know if anything causes you pain. And more superficial pressing in the 4 quadrants. Again, you're doing awesome. Going to listen to your bowel sounds in all 4. Just make sure everything intestinal sounds normal. Okay. And those sounds are okay. A little bit of tenderness here. Okay. Alright. Next up is I just want to assess some general reflexes in your extremities. So we're going to start with the lower legs here. Okay. Very good. Okay, let me cover you up there. We're going to go to your arms here. Wrists. That arm. Good. Alrighty, and just to assess for sensation in the feet, you let me know when you could feel something soft. Good. 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 Alright, let me do one final skin assessment. Just making sure we do our due diligence here. Okay. Alright, so are there any other problem areas or other concerns that you had? Okay, good. Just want to make sure we cover all of our bases here. So we got the swab sampling, which is very good. I am going to go run this in the lab real quick, and it will let us know what you have. In the meantime, I do have some general prescriptions I want you to get started on. It's super important that you stay super well hydrated, okay? Yeah, there is a lot going on right now, so I just want to make sure that you are fully good to go and that, of course, you're protected. There are, like I said, a couple medications I do want you to get started on, so I'm going to leave the dose in the cap here for you on the side so that you can take this. A couple tablets and a couple capsules. So I am going to leave that there for you. With that being said, the assistant's going to come in, get you some water, give you those tablets to start off with, and then what's going to happen is I will come back in to talk to you about your results shortly, okay? Oh, absolutely. It was very nice seeing you, although of course not under these circumstances. If you need anything or you have any questions or any concerns, you let me know. You give the office a call, and I hope that we get you feeling better very soon here, okay? Yes, absolutely. So, the medical assistant, she'll be in to give you that water, and then we'll be in shortly to talk about the results of the swab tests. For sure. All right, you hang in there.